tips and tricks in aesthetic rehabilitation. It's a very important topic. And our speaker today is a celebrity in cosmetic dentistry and aesthetic of this specific topic. Dr. Noor Mashaha is a resident in orthodontic department in Riyadh University, and she's cosmetic dentist in View Clinic as well. I'm not. I don't need to talk about her. I'm sure many of you already know her, but from her cases and from her maybe from social media as well. Brilliant in aesthetic topic, and she's going to take you through the those tips and tricks. I'm sure it will be beneficial for your practice. I don't want to talk a lot about it, but it's just for you can see 3 buttons in the bottom here. So in case you need any, if you have any question, so you can select Q&A button and type your question. So those are the questions we'll be answering at the end. However, if you have problems, if like the sound is not clear or something, so you can send it in the chat button. Okay, and there's another button which is, I don't know what we can do for, which is raising hand. I don't know what we can do with this, but it's for comments or questions. Questions for Q&A and comments or in the chat, or you have any issues or something. Okay, so I'll leave you now with Dr. Noor Mashaha. Okay, so Dr. Noor can share her screen.
Yes, hello everyone. Okay, I'll start.
Yeah, you cannot the voice, yeah.
Thank you. Okay, it's clear now?
Good.
Okay. So today we're going to talk about aesthetic case rehabilitation tips and tricks. I will minimize this one just to let them show. Yes, right? So we divided the lecture about direct and indirect restorations. We start for direct restoration composite fillings. Always when you are thinking about the case rehabilitation, try to make it simple as much as possible. So this patient came to my dental office, complaining his anterior teeth. It was discolored and chipped, okay, and my patient, 35 years old, his fit medical health, and he's heavy smoker. He has class 5 and class 4 old restorations, and I start a treatment for this case. Always isolate by rubber dam, okay, and always take some photos before starting and during your work. To create nice halo, cut back the dentin in line with the anatomy, okay, for making it natural dentition with the adjacent teeth. And we can see when we cut back the dentin in line, we can see how the details will be much better. And use water-soluble gel just to make it after dehydrate. And we'll apply it on the tooth, and composite will be polymerization for 60 seconds, okay? This to ensure much better conversion of the surface layer of the resin, okay? And will result of the oxygen inhibitor layers. I always prefer to use cut-up polishing buff to make smooth textures and details of the tooth. I recommend don't use any form of polishing disc in the middle part of restoration because this will reduce the texture and will affect the perikymata. Sorry. The case was before. So as I recommend in the beginning, always take some photos to reevaluate, and shade should be taken before start your preparation of the composite fillings. Also, to always recheck, okay, the shape and shade and texture of the restorations. So as I told you, the most important tip is the isolation with rubber dam. Okay, we can see this class 4. When you try to remove rubber dam, try to remove it gently and cut between the proximal contacts. Okay, we can see, and always check all the details before finishing your work. I always recommend my patient to come after 20 and after 48 hours, okay, to do the final finishing. We can see, take your time, even it takes long time. Use selective etchant procedure and universal adhesive, okay, for bonding procedures. Always make the class 2 start by proximal contact area and change it to class 1, okay, so it will be easier to build up your composite filling. So evaluate the restoration after 48 hours before the final final finishing and polishing. I like to use multi-blade bare because it's much better than diamond bare. It's gentler for the enamel. It will not damage the enamel while you're finishing the restoration. And I finish my work by disc. I prefer this kind of disc. Okay, so we can see also how the details are drawing on the restoration. Always try to make your work, there's no need to use 1,000 layering just to make your work fantastic. You can make it simple, just to make it like natural teeth. Okay, you can start for the lower by the lingual cusp. You can see how we have to do adaptation of the composite filling for the margin. I try just to make it, to share my tips in my dental practice and make it. I prefer also to use water-soluble gel on tooth, okay? And the composite with polymerization for 60 seconds. If the composite filling is deep, you have to increase the time of flat curing. And the water-soluble gel will apply on the tooth just to ensure much better surface layer of resin, which is otherwise not polymerized enough as a result of the oxygen inhibited layer. The final tool I get is glaze finish. Okay, I told you about this too. Clean the dentin. Okay, always when you are preparing the composite filling, don't do over drying for the dentin. If you did this by wrong, you can take a small cotton rolls and dip it in some water and put it in the cavity on the dentin for a while. Then you can prepare the cavity again. So this case, class 1 modified 1. So correct isolation with rubber dam starts before the cleaning of the caries. You will reach a better adhesion without saliva contamination. As I told you before, stop building the interproximal wall, so you can change the class 2 to class 1. There's no best way one among layering techniques. You can use a horizontal, vertical, or oblique one. The horizontal one is easier, okay, to perform, but keep in mind that what you have to reach is a good result, okay, nothing else. And you can get it, well, each and every layering technique. So this is how start building the interproximal wall first. So to change between the class 2, class 1, and you can see, even it takes time, but you will be interesting while doing the bulk material for the posterity. So use an easy modeling technique. No need for reproducing something that is natural, doesn't exist. The essential is more than enough. Okay, when you finish doing the composite filling, you have to check the occlusion. Okay, if you have restorations and the patients in
معلش دكتورة، في ناس بتقول الصوت واطي شوية، فلو sorry to interrupt, but just to raise it a little bit.
It's okay.
Okay.
الصوت واطي so
قرب المايك شوية يعني.
اوكي، علي صوتي.
يا ريت please.
Okay.
Thank you.
Okay, so I use Shemstock to check the occlusion, and the patient, if the patient has adaptive occlusion, I use MI to check the occlusion for the restorations. If I found heavy marks, I have to remove it. Okay, if I found error marks, also I have to remove it. Always check the occlusion before start doing your restorations. If you found there's bull's eyes before doing your restorations, there's no need to remove it after restorations. If you didn't find it before starting and you find it after restorations, you have to remove it in range. So, how to use sectional matrix in order to achieve functional proximal surface? Okay, we can see that we have to do a good adaptation of the matrix. If it's not adapted well in the proximal area, you can use Teflon. You can place it and providing forceps. It's necessary to improve the quality of the adaptation. You can use liquid flowable composite, and etc. I also like Balodent of this matrix. For the light curing, how many dentists usually check their light curing in their dental offices before doing the procedures? Actually, it's very important to check your light cure and use it in the right direction. It all starts with access. Sorry for interruption. Okay. So when you are going to do light curing for the restorations, you have to put it on a full coverage of the restoration. There's some tips for success light curing. Before starting, you have to clean the tip of the light cure, and you have to check the right time for according to manufacturer's instructions. And you have to know how to access the restoration position, and don't forget to wear your eye protection and cover the restoration with tip position. Okay, near restoration. You have to make it near and work as recommended time. When you're done, clean and disinfect and check the output regularly. So put in your mind, you have to do completely cover for the restoration by light curing and continuous with positioning. Large active diameter 10 millimeters is always recommended. So now we'll talk about core build-up and post-placement. Okay, so what's the challenges around adhesive placement of fiber post? I will see your answers. Okay, I'm waiting you to answer this question. Okay. So, separate light curing of the adhesive may be impair post-fit due to adhesive pulling at the bottom of the post space, due to alteration of post space geometry through adhesive film thickness vertical walls. You know, we have to put in our mind that the post length and diameter, surface texture, luting agent will affect the placement of fiber post. Okay, after placement fiber post, please make sure that the remaining cotaberca for the apical seal, it will be 5 millimeter. Sufficient arrival at light in the depth of the post space is questionable, and it doesn't arrive to the apical seal. So we have to use draw cure or self-cure resin to cement the post. What about light curing the adhesive and resin cement altogether right through the post? I use paper point when I apply the bond, just to remove the excess bond, okay, and avoid pooling of bonding materials. Always when, for each step you have to take X-ray and check the work sequence. Universal is the adhesive for core and post. Okay, we can see the sequence work of the procedure for the post, caries excavation, and then start institution. When you remove all the caries, you can remove the root canal filling by piezo drill, and as I told you, you can keep remaining cotaberca 5 millimeter of the apical seal. Post space preparation, easy protect precision drill, make it on a low speed as your size of the post. Then try the post, do the try end for the post. Okay, then you can cut the post etchant of the canal for 15 seconds maximum. Okay, and then do complete etching for the enamel and dentin. Then do rinsing at least 15 seconds. You can do air drying for the canal and do the paper point too. After that, you have to do mix of activator, prime and bond active. Okay, and at least for 2 seconds. Then you have to put the bonding within the canal for 20 seconds and complete bonding too. I use paper point to avoid pooling of bonding material for 5 seconds. Then I will apply also air drying, and then I will put bonding for the post for 5 seconds and air by 5 seconds too. Then I will insert it to canal. Please place post within 14 seconds because cement application will polymerize quickly. And then polymerization, at least 20 seconds. After that, you can check the post and start doing your core build-up. Always make sure that you do an initial preparation to check the ferrule effect before start doing these procedures, because if you don't have sufficient ferrule effect around the tooth structure, you have to think about surgical for doing crown lengthening or surgery or ortho just to wrap the tooth to make sufficient ferrule effect. Then core build up, polymerization of core build up, 5 to 10 seconds. Okay, then you can finish your preparation. Don't forget for the ferrule effect at least 2 millimeter. There is a review article about ferrule comes first. I want you to go and read about it. Also, there is evidence-based treatment planning for restoration of endodontically treated single teeth. importance of coronocia, post or non-post, direct or indirect restoration. Also go and read about it. So we talked about composite filling, post and core. Now we're going to talk about indirect restorations, inlays, onlays, overlays. Okay, we'll see this video. Okay. When we lose more than one cusp, we are thinking about onlays. Everything is clear. I can't see the chat.
Yeah, it's you can press the chat button. It's there down. You can see
Here?
all the chats, I guess.
Oh, okay. Sorry. So if there's anything necessary, just tell me, okay? Because
Yes, sure.
okay, thank you. So for the indication of the onlay, it's aesthetic, okay? It's excellent translucency and good soft tissue response. Sorry. Okay, it's conservative more than crown. Sometimes it's difficult to matching the color between onlay and tooth. So you have to think about shade mapping. About the disadvantage of onlay, it's sometimes fracture. Takes time because it needs fabrication technique for the impression, lab work, try-in, cementation, follow-up. And we can do it by hot pressed 1.5 thickness. Okay, sorry for back. Here we can see the endocrown, but I don't know why it's not working. Sorry. Okay, sorry. It's not working. This is an endocrown. Last studies showed that it's very successful when it's indicated. We can use it for the posterior. Don't use it for the anterior teeth or premolars at all. We have to. The tooth should have structures because it's reason restoration. After doing the cementation of the restoration, you have to check by the X-ray to check the adaptation and the proximal contacts between the adjacent teeth. This is for overlay. My patients came to my dental office, tried a lot of composite fillings before, and she didn't prefer to do crown or even composite. I guide her to do overlay. Okay, and then I apply the resin and the restoration. When you're done, check the proximal and do the finishing for the proximal contact. Okay, for the try-in phase, you have to check the margin, you have to check the adaptation, you have to check the proximal contact. Try to use shim stock between proximal contacts to check if it's cross between proximal contacts or not. And it's hard a little bit to check the occlusion by overlay or onlays and lays because we need to make it fixed on occlusal. So now we're going to talk about veneers. All of us know that this laminated veneers is a treatment option for patients for aesthetic problems or even problems, stains, cracks, spaces. Okay, this patient, she's 25 years old, came to my dental office, complaining her lateral. She did a veneer before, 5 years ago, and it's an open margin and it's big. So I make a provisional restoration for the lateral of tooth number 22, and I reduce the margin. And a week after week, I instruct my patient to follow the protocol that I give for the right way of the massage and brushing her teeth and daily routine of taking care for her gum. So after 21 days, 3 weeks approximately, the gum appear like the adjacent teeth of the 1-2. And after that, I start doing my preparation and fabricate the laminated veneers for the number 22. We can see how the smile appearance looks differently than before. And here we can see that how the preparation was after healthy gum and contour. Okay, here I'm applying the bones for preparing the case for cementation. Here also, there is a case, came to me, she did 2 centrals 1 year ago. She complained her shade and shape is shorter than her teeth before. Then I just remove it and start doing my preparation. I already changed the in the Dentic treated teeth, change the post, and that's it for the selecting shades before preparation, and that's the final restoration. You can see the translucency and how I did the shade mapping. Okay, excellent translucency, and we can see good soft tissue response for lateral views, frontal views, and occlusal views. Sorry. Everything is clear. Sorry, my voice is clear.
Yes, it is clear.
Okay. So, I'll continue. Sorry, just my mouse disconnected. Okay. Here I will tell you a tip when I do cementation for the crowns. Always try to remove the excess cement in gel phase. Don't wait to be hard, because it will be so hard to remove, and then you will use the high speed to remove it, and it's not official. Okay, here you can see you have to put adequate resin cementation on the crown when you are going to do cementation, and you can see how the impression is clear. I always prefer to use polyvinyl siloxane impression material, 2 steps techniques. So for the cleaning up resin cement, I told you to remove it in the gel phase. It's easier. And for plaster model, here you can see the stone. Okay, when you retract the tissue better, the dental lab will see the margin, and you can see how the gingival sulci are opened, and that making the preparation margins clearly visible for your dental lab. And that will help to do adaptation of your margin and will make it. Okay, you can see I always recommend to do suprachangeable preparation margin. Okay, I put double cord, one before start preparation, it's 000, and 100 in the socket after preparation, before the polishing and before taking the final impression material. This patient, she's 23 years old. She came to my dental office. She doesn't like the centrals because she did composite restorations 9 months ago, and you can see that it's not symmetrical between 11 and 2-1. The midline shifted. So after removing the old restoration, okay, I just do a minimal prep for the centrals, and then I do the finishing for my preparation, and this is the final result after cementation. Okay. Also, you have to check. I recommend always don't let patient look in the mirror on the chair. Let your patient check his smile in photos or in a wall mirror. Okay. So this is in the wrist. This is an exaggerated smile. You can check how the shade is matching. Okay, the translucency for the incisal. So when you will do impression material, always check that to be hydrophobic, not tearing of flash area arose, and the preparation margins should be clearly visible. Okay, so high tear strength. You can check how the margin. So you have to know how to read the impression before sending it to dental lab. Okay, here we can see the minimal preparation. Okay. This is for temporization. Temporary should has characteristic. Okay. Should be ease of fabrication, dental chair visit. We can see. Sorry. It feels that I missed something. Okay, we can see the preparation by split dam application. After doing initial preparation, I remove the caries and start doing my restorations. Sorry, I don't know what's going on. Sorry, I feel something missing. Sorry. I missed something. Okay. How I use bite silicone to close the palatal, just to prevent anything to access while doing the preparation. Side to side, I apply it. Okay, this is after treatment and after preparation. Sorry. That is. And this is after impression. Okay, for post-fabrication, Sorry, I will swipe because there's something wrong here. Duplication of the slides. Sorry, just a while. It's not my presentation, Dr. Tariq.
Okay.
I think there's something wrong here. Some slides is missing.
All right, you can go to the original slides, no problem.
What I can do? This is my presentation. I don't know how it's changed, actually.
No problem, it's like missing slides.
Yes. But now it's back. I don't know how.
Okay, good.
Sorry.
Some glitch or something.
Okay. Sorry. Okay, this is the idea preparation for retentive preparation. If it's not retentive preparation, we can use also resin cement for cementation of the short or not efficient crown. Light putty was applied on the teeth preparation. I told you that supragingival impressions are easy to take. Subgingival impressions are difficult to take. Okay, always when you will apply the retraction cord, start by proximal area and gently insert it inside the sulcus. Tip your adrenaline cord in a hemostasis agent. And now we'll discuss this case. She came to my dental office also, doesn't like her small appearance and also the shade and stains. You can see the intraoral pictures and extraoral pictures for the frontal and lateral smiles. Always just a tip put in your mind for the traction cord. Place it and don't place it in unhealthy gingiva. Try to wait until the gingiva will be healthier. Okay, for the supragingival preparation margin, it always recommended and I prefer it. So this case preparation, we can see thin cord is placed without overlap to the bottom of the gingival crevice, and second cord is placed on top to achieve lateral tissue displacement. This is the minimum prep of the case. You can see how the margin look like. For the impression, before removing the cord, moisturize it, okay, with water, and then you can gently remove it, dry the tissue, and take the impression in a light material. It's better to delay impression making and concentrate on how to improve tissue health. Now, this patient, after doing gingivectomy by the surgeon, by the specialist of periodontist, and you can see the pictures for after healing of the gingiva. And then I start fabricate my prosthesis of 8 units laminated veneers for the shade B1. So details of perfect and natural fit and margin adaptation of the ceramic veneers. You can see the goal of anterior and direct restorations is to replace the natural outcome, the dental tissue. We can see the occlusal view of this smile and how the incisal edge, how the natural aesthetic and function precise fit the occlusion margin. and the patient is satisfied about her smile. Okay, always try to document every thing and take photos for the steps too. For the impression materials, most of clinicians want precise placement and turn back the crown or redo the impressions or concern about tissue management, or they want also better hydrophilicity. This is related to impression taking. Dental labs confirm findings that we have 47% of clinicians that the impression materials is not top challenge. So make it anyway and try to practice to make a good impression. Choose your impression material. I just will give you a tip. When you, for example, mount the cast and you will take an impression for the upper jaw, for example, you will go to use to do 8 units for veneers, for example, for upper only. Take the same material of impression for upper and lower jaw and even for the bite registration. Because when you mount the cast, for example, you take the upper by silicone and the lower by alginate and wax. There will be error in occlusion when we mount the cast on articulator because the wax bite will not adapt to the lower jaw that takes by alginate. That is the last study that I read about. So I recommend to take the impression for materials for upper and lower, even if you don't have work for the lower, by the same material, okay? And bite registration also. So healthy soft tissue and control of saliva flow are essential for a successful impression. We can see how the healthy gum are here with adrenaline cords. And I'm going to remove you can see no blood because you take your time and gently you place your cords on healthy gum. What's an important of diagnostic wax up? Okay, so when we have full mouth rehabilitation, you have to think about what's the problem, how to discuss all the treatment plan with your patients, how to explain the details. So you have to make a connection between you and dental lab and your patients. Diagnostic wax up, it's so important for full mouth rehab, and you can let your patient imagine how the treatment sequence will be then. And the detailed diagnostic wax up and mock-up should be evaluated. And also, I recommend to give a patient provisional restorations depending on the final wax up you did. So the patients will used his new restorations and a new bite. Also, mock-up is very important for guide for minimally invasive tooth preparation. So, for treatment planning with your patient, you have to explain everything to your patient about the plan, time, and cost. And also, you have to select the cases. If you find that the case is not indication, for example, for doing veneers, refuse doing it. So also, you have to discuss all the details related to treatment planning for a patient, even if the patient refuses to do it, because you have to explain everything to your patient before starting. And a good relationship with your lab is a key to quality work. So always ensure that when you take a shade, take a picture for dental lab, show him the shade mapping. When you do try and make sure that there is no error in shading or shade shifting, okay, because sometimes when we do try in for shade material and then we go to the cementation, we see shade shift. So try always to make everything in a rule and depending on scientific evidence. Here we can see how the mock-up. I think most of us know how does it work. That's how the dental lab work will be so clear and accurate. Simple solution for difficult situation. This patient came to my dental office. He didn't like his smile appearance, odor, his heavy smoker, his medical fit, and he's 35 years old. He's looking for a smile and confident while smiling. So after a work of his smile, do treatment and retreatment, and I increased the video. I think there is a questions, Dr. Tare.
Yes, there are a lot of questions actually, but I think at the end we can go through them. Yeah.
Okay. So
please continue.
yes. So so the sequence of the work, you have to take initial impression for the study and keep it, and you have to take another impression for mounting the cast. For such these cases, you have to take a CR relationship between maxilla and mandible to work your full mouth rehabilitation on it, and mount the cast for the occlusal. And you have after that, you have to make a wax up, diagnostic wax up before start doing the preparation. After that, you have to remove the prosthesis, cut it, and then you have to do initial preparation, check the restorability of the teeth. If the teeth is restorable or non-restorable, you have to refer the patients to the specialist in the dentist and do a necessary treatment for the phase number 1. And then you have to transfer to check the perio situation if there's any modification should be done for this case as a mock-up diagnostic that you did before. And then during these procedures, you have to apply provisional restoration as your new video that you did for the patient, and instruct the patient to tell you all the details while he's trying this diagnostic wax up, because it's very important to take all the details before processing the final restorations. Okay, after that, the prosthesis is done and come from dental lab. You have to try it on your patient, try in cementation, and let your patient stand on a wall mirror and see his smile appearance, how it looked like. You can see if the patient is happy and satisfied about his new smile. Okay, so you can try to let your patient say phonetics, try the sound S and F. We can see this case too. This patient has, for all restorations, bad odor, and he's 29 years old. He's also a smoker, and his medical fit. He came to my dental office, complained his smile appearance and the odor, also the gingivitis. And you can see the picture below. It's after ortho and provisional. I just I just instruct my patient to do ortho treatment with orthodontist. And after a year and 2 months, he back to my dental office, and I just start for fabrication of the new restorations. You can see the provisional, how it's important to make a provisional restoration that is affect the soft tissue and help to make healthier gingiva. Okay, this is after ortho treatment And then I start fabricating my prosthesis, starting by endodontically treated teeth abutments. I refer the patient to do retreatment for the 4 abutments, okay, because the prognosis affect the remaining tooth structure and type of restorations. And because it's 4 anteriors, I like to make more aesthetic, more translucency. That's why I have to have a very good endodontically treated teeth without discoloration. So then I fabricate the new restorations. You can see the final restorations in the pictures below. How it's intraorally and extraorally, and how is the gum look like. This patient came to my dental office, complained her spaces, crowding teeth, okay, and she doesn't satisfy to do ortho again because she did it before. She's 31 years old. You can see that how important doing videos before starting, after starting, and check all the functional and movements of the jaw and the phonetics of S, C, and how she speak, how she bites. Okay, we can see the case before for the lateral and frontal view, and the case after. I fabricate only 4 prostheses. Even she came to my dental office, she wants to change all her smile. Okay, I check the translucency of the incisal edge. It's very important to do try and visit before doing the last cementation. I like this position because I can see the angulation of the teeth and the smile line curve, if there's a protrusion, or how is the horizontal and vertical overlapping of the teeth. After placement the crowns and applying resin cement, as I told you before, you have to remove the excess cement when it's in gel phase. I usually use shim stock matrix or blade, but I prefer this because it's not danger for the papilla. We can see how in the rest appearance looks like, and the translucency is natural effect. You can see the matching color between upper and lower. I have to tell you something, because when I did a try-in, it was much lighter in color than lower, okay? So it's very important to do try-in. Why? Because you know how to choose the final cement color, okay, for your restorations, and make it matching the adjacent teeth. This patient came to my dental office, complained her old restorations. You know that this patient showed me her pictures when she were bride. Before doing this prosthesis, her teeth was in a normal bite, but after prosthesis, she lost her bite. We can see it's a cross bite now. This is the other side. She did only 6 units. You have to keep attention for the axial of the preparation when you're doing it. Okay, you can see how the gum, how the bite, how the appearance of the tooth, and this is the after. I will show you step by step how I fabricate this case. You have to think about vertical dimension and working on CR. Okay, this is occlusive view for her old restorations. And also you can see how she did endo treatment on prosthesis and cover it by composite filling for the access cavity. I removed the old prosthesis by cutting half-half and remove it. You have to be gentle while removing. Don't remove it strongly. Sorry. Okay, you can see how the teeth look like after removing the prosthesis. I don't think so that I will work for this teeth as abutment teeth. You have to select your abutments as well. The teeth after retreatment, after core build up, after sufficient ferrule effect, and after final preparation. You can see how the inclination of the preparation is coming buccally to provide the space for restoration to make the overlapping near to natural dentition. This is the final impression too. I always fabricate two impressions, okay, especially for the patients outside of Riyadh. We can see how the smile gonna be after, okay, you can see intraorally, extraorally, before and after the procedure. So I just changed 6 units. I just think about all the details and discussed it with my patient. I didn't tell her I will do a perfect smile. No, just put expectations for patient, not let him dream about a new smile, okay? Let him limit about his smile and how it looked like by doing provisional restorations before doing the final restoration. Provisional is so important. Okay, you can see how the overlapping looks like. Okay, what your eyes see, always. This dentist came to my dental office, complained his fluorosis. Always try to find the classification of the case for per unit, okay, if it's mild, severe, moderate. So I just treat this case as the classifying of per unit. For the canines, for examples, I did composite filling. You can see for the picture on the right side below. And I fabricate only 4 units laminated veneers and do a treatment procedure. Sorry. Is my voice clear?
Yes, Doctor, yes, it's clear.
Okay. So I fabricate only 4 units, and when I finish this case, this dentist thanked me about that I make it conservative and minimum prep without doing preparation for the all teeth. We can see this patient also. She's complained her direct veneers, composite filling facing. I don't prefer it and I don't like it at all. After enhancing the patient to improving her gum health, I start preparation for upper and lower. You can see how the gum is healthy, okay, during preparation. And this is the dental prosthesis that I fabricate then. During the time, maybe this case takes more than 6 months because we need time for healing. I didn't trust my patient actually because she didn't take my instructions as well. So I take my time just to make sure that my patient will keep her gingival health healthy and take my instructions as well. You can see the lower and the upper. Minimal preparation, okay, and healthy gum before taking an impression. Okay, this is, you can see the smile line, the shade and shape, how it's perfect. This case came to my dental office after did the treatment for the 10 units of upper in the treatment. Okay, you can see the discoloration because of accident, and there was abscess on her upper teeth. After discussing with the patient, I decided to do only 10 units crowns for the uppers. And after doing some retreatment for the endo-treated teeth, I fabricated this prosthesis. Okay, this case too, missing her central 11, okay, when she was a child, and she did ortho treatment, and they put the lateral on the central place and changed the appearance of her smile. She's 29 years. She will marry after a while, so she said, I want to change my smile and please try to make it natural. I just discussed my patient about the treatment options of her case, if she can do ortho and implant to replace the missing teeth. I discussed also another options if we can do 1 unit for the number 1-1. She said, I want to change my smile appearance for the anterior and close the spaces between the 1-3 and 1-4. Then I start fabricating my new restorations. B2 shade, okay, and this is the final restoration. I think there is you can see how the result of the gingival papilla look like. And when I did the preparation, I keep in mind the midline. I didn't take too much tooth structure of the 2-1, and I try to make the midline approximately near to the fulcrum. Okay, this patient came with her post and old amalgam restorations. She wants to change her smile appearance when she smiles and laughing and exaggerated smiles because she don't like the dark color of restorations. I just fabricate crowns of the canine, premolar, molar, and onlays for the molar of the left side. Okay, now let's do practicing. Sorry. Okay, Dr. Tariq.
Yes.
Okay, if you have a case like this, always try to redo the post, check the restorability of the teeth. I don't recommend you to do your preparation on such of these apartments. Okay. Also, some of cases that I face in my dental office, this case you can see it's ortho face. It's ortho case, and they make it veneers. She's 21 years old only. So please, doctors, select your cases. Okay, and this is the last case of fabricating the 4 units bridge anterior. And I'm waiting your questions. Thank you.
Great. Thank you so much, Doctor, for the nice